Well, speaking of New York Governor Andrew Cuomo, let's talk a little bit more about that. We can take it a step further because not only did he tweet out after months of support for lockdowns, he now wants to reopen the economy, and we have some sound on it too. Listen.
We simply cannot stay closed until the vaccine hits critical mass. The cost is too high. We will have nothing left to open. We must reopen the economy, but we must do it smartly and safely.
What sparked the Cuomo 180? Let's bring back our panel. Bill, what was it?
Well, I mean, Governor Cuomo is a fraud. I mean, this is a guy that he did win an Emmy, though, so maybe we should take him seriously. I'm not sure. Here's the bottom line. None of these politicians, not Republicans, not Democrats, have cut to the core of this issue, and that is lockdowns kill. There are so many examples across the world. You don't even just have to look at Sweden. You can look at Japan. You can look at South Korea. Economies that stayed relatively open did not go into these draconian lockdowns. And there is literally no correlation between a state that locked down and a suppression of this virus. As a matter of fact, if we're going to take anything credible from the World Health Organization, we should take the stats that they released about a month and a half ago, where they said at that point, more than 750 million people in the world have contracted coronavirus. That puts the mortality rate, the infection mortality rate, at 0.13. The flu is 0.11. This is a bad viral season like we've had in the past. If we had been reporting these kinds of numbers per 100,000 percentages, hospital rates, in 2018, with the horrific flu season we had, which actually led to needing temporary hospital tents being set up, but nobody talks about it, we could have justified a lockdown then. The bottom line is mask mandates don't work. The virus spreads. The good news is that with all of these different strains out there, I believe 30 mutations, that it is getting weaker based on the fast recovery rate. We do not have a crisis. ICU beds are typically filled between 70 and 80% in a lot of the states that we're talking about. Okay. We just have to open up. I mean, it's absurd to even look at this any other way. Okay. The lockdown didn't work. This belongs in the medical space discussion, not in the political space. We're going to separate the two immediately.
Kelly?
Well, we need to help people that are struggling personally, professionally, and financially. And first, we got to give them more money. We got to give the stimulus, the $2,000 that people need.
What about opening up, Kelly? Kelly, what about opening up? I mean, I understand giving people money, but what about just opening up the economy?
Right, and as I was about to say, is that it's really important to get these small businesses that are struggling, get them open up and do it safe and do it smartly so people are protected, but that people can save their business, and people that are working there also have jobs to put, money, food on the table and help the American people.
Yeah. I was looking at the numbers, and Bill, I took from the CDC, the number of cases in the United States and the number of fatalities came out to 1.6% fatality rate. And I'm guessing there are a lot of people that have had COVID or have it that have never been diagnosed. So that number actually would be lower, maybe close.
Well, not only that, but Bob, I think there are really two key points to that. Number one, the CDC came out, said 94% of the deaths had 2.6 average comorbidities. That's number one. You've got people dying with COVID, not necessarily from COVID. Number two, this really jumped out at me, and none of the mainstream media picked this up. The Nevada Health Department came out in a written statement and said that anyone who dies from natural causes within 30 days of a positive test is listed as a COVID test. We have panicked people over nothing. Okay. The death count is so grotesquely inflated that I don't even know where to begin to dissect this. Okay. Pennsylvania, New York, New Jersey, all admitted padding the numbers. You know why? Follow the money. Kelly, you're talking about sending more money out there. The truth is, money was the downfall of this thing when we started incentivizing hospitals to intubate people. That's the problem. Get the money out of this. Reopen everything. Stop this gravy train for big medicine.
All right, we're done here. We're done here.
Oh, my God.
I want to give Stacy a chance to comment, because Stacy, other people are watching and saying, well, wait a minute, 320,000, 80,000 are dead now. You've got ICUs filling up in California. There are people say there's some real problems. Bill's saying, no, we're overdoing it.
Well, listen, so first of all, people don't understand how ICUs work. ICUs they're expensive to set up. So our hospitals actually set them up, and every winter we are full on ICU bed space. So that's something that people should really look into. Every winter, our ICU beds are full because we don't have extra ICU bed space. So that is an improper metric to use if you want to talk about whether or not we're handling this well. We have our PPE, we have our expertise on treatments, we have all of the protocols that have been introduced, we have the vaccine for people who want it. But I agree with Bill that we need to reopen. What I don't understand is why we had to wait until now, just before President Biden, incoming President Biden, will be inaugurated at the end of President Trump's term. What was wrong with reopening last year? What was wrong with treating this like the flu?
Took them 10 months or 9 months to figure it out. Yeah, it took him a while to figure out what a lot of people figured out after we flattened the curve in 15 days. It's like, I'm not so sure this works that well. Folks, we're going to take a quick break here, come back and continue the conversation. We did want to remind you, if you go out and about, you can take us with you on our app. On your smartphone, on your iPad, whatever it might be. It's the Newsmax TV app. Download an iPhone, Android, start watching. It is also free, not like if you have to go through some kind of subscription to get to some of the other major cable networks.
Nope, 100% free, just to reiterate that. And that's why millions of people are now using the app. It does take less than a minute to download it. So you just head on over to the App Store on your iPhone or Android phone and download Newsmax TV, one of the most downloaded free apps in the store. So head on over. We know that you will like it.
All right, we're going to come back and talk more on American Agenda.